Welcome back to Grandma Needs Rehab. And in this episode, we talk about diabetes. Actually, it's how grandma had a mini stroke because of uncontrolled diabetes. So how does that happen? How do you get a mini stroke or a stroke? How does it affect your nerves? How does it affect your kidneys? How does diabetes do all these bad things to you? Well, let's ponder that. Before I start yapping about diabetes and sugar and all that stuff, there's a couple things you should know. First off, I'm Dr. Steve, and I am a real medical doctor. I've been board certified in internal medicine and been practicing hospital-based medicine now for, well over 20 years now. And the things that we're about to talk about, this is informational and educational purposes only. We just talk about kind of what things are and what we think about and kind of why we do some of the things that we do. This is not medical advice. So if you have any problems, issues, questions, please talk and contact your doctor and, enjoy. Before we get to the mini strokes and all the heart attacks and all these other things that diabetes can do to you, you should probably understand a little bit about what diabetes is. So what is diabetes? Well, diabetes is a lack of insulin. How does that cause diabetes? Well, insulin actually helps control your blood sugar. Well, what the heck is insulin? Well, insulin, for those that are really interested, is a peptide of 51 amino acids. Yeah. Anyway, a peptide is basically a protein, and that protein is made up of 51 individual amino acids. I'm sure there's some people out there that are excited about that, but for most of us, not so much. But that's what insulin is. Well, where does insulin come from? Insulin comes from your pancreas. Which is an organ right about there, right beneath your stomach, actually. To recap, for those that are interested or have an attention span kind of similar to mine, your pancreas makes insulin, which is a protein. And that insulin protein controls your sugar. Well, how does it do that? I'm glad you asked. Insulin acts as a gate to allow blood sugar to kind of get to where it needs to go. And my little brain thinks of it this way. If you have something there in your body, doesn't matter, organ, system, whatever, let's say it's your muscle. So you have a muscle, okay? But this could be anything. Surrounding that muscle on the outside is blood. So how does your muscle normally get things like nutrients and things like that, and oxygen and all that other stuff? It comes from blood. And what's floating around in blood? Well, sugar. Unfortunately, sugar is kind of stupid. And the sugar, as it's floating around the bloodstream, doesn't know where to go. But your muscle needs the sugar for energy. So how do we get the sugar from the bloodstream into the muscle? Well, that's insulin. Insulin comes along, and what it does is it opens up these little gates. And now that those gates are open, the sugar can kind of, go do its sugar thing. And as the sugar gets into the muscle cell, and again, this could be anything. This could be organs, this could be tissues, this could be skin, this could be anything that needs sugar for energy. As that sugar gets in there, your muscles can use it, or your noodle, or kind of anything else that happens to be requiring some energy at that particular time. The other side of that is what happens when you don't have enough insulin. You still got sugar, and it's still floating around the bloodstream because you're still eating it. And even if you're not eating sugar directly, the foods that you eat, a lot of the carbohydrates and things like that, they get broken down into sugar. So even if you're not eating a bunch of, sugar cubes, I don't know why you would, but you're still getting sugar. It's just your body is breaking down food that you eat into sugar, and it's floating around, and it can't get to where it needs to go because there's not enough insulin. That's essentially what diabetes is. And as this sugar floats around for, long periods of time, it can do stuff to you, and it's not great. Now, another thing we talk about, or actually we don't really talk about it because, it's just kind of weird conversation, but one thing that insulin does that a lot of people don't think of is it prevents something called gluconeogenesis. Yeah, I had to look at how to spell that too. But gluconeogenesis is basically a big fancy term that means to make new sugar. And your liver, which right about there, actually can make sugar. Sometimes if your sugar levels are low, like, I don't know, it's suppose you haven't eaten because you got a big something. Anyway, or you're exercising a lot and you kind of burn off a lot of that sugar and your blood sugars are starting to get low. Well, sometimes if we don't run and eat right away, our brain senses that there's a problem because our blood sugar is getting a little on the low side. Well, how do we get more sugar if we're not eating? Well, our liver can make new sugar. It puts the little parts together and actually makes sugar and then kind of spits it out in your bloodstream. So, you feel better. So if you've ever felt real jittery because your blood sugars are getting low and then a little bit later you start to feel a little bit better even though you haven't really eaten anything, a lot of times it's because your liver's making stuff. Now, interesting thing about insulin is that insulin will tell your liver not to make sugar. Well, why is that? Well, if your insulin levels are high, then your body recognizes your sugar is too high. Okay, your sugar's high, so your body's spitting out a bunch of insulin. You don't want to be making new sugar if your sugar is already high, and thereby your body has to create a bunch of insulin. So if there's a bunch of insulin floating around in your system, that's a sign that your sugar was too high. That's why the insulin is there. And then the insulin tells your liver, knock it off. We're good. We don't need any more sugar. So now we kind of understand what insulin does. And because we understand what insulin does, it's a little easier to understand what happens if we don't have enough of it. So if we don't have enough insulin, that means our muscles, organs, all that other stuff may not have enough sugar for energy. They can't, it's floating around in there. They just can't use it. And unfortunately, as it builds up into your system over a period of years, it can start to cause problems. So that's diabetes. Now, kind of where that comes from or why you don't have insulin or why you don't have enough insulin, that kind of determines what type of insulin you have. What I meant to say there was it really depends or determines what type of diabetes you have. Obviously, lack of coffee. There are actually 3 types of diabetes. And unlike Deadpool, for those that enjoy like I do, you can't get triabetes all at one time. But there are 3 major types that we deal with. The first one is diabetes type 1, and this is that 1 for type 1, and that's usually in children. And a lot of times the pancreas, that part that makes insulin like we talked about it, that pancreas unfortunately gets damaged usually when children are very, very small. And the parts that make insulin called islet cells, not that you're particularly interested in that, but if you were, that's where they come from. But those islet cells get damaged as a very young, child. And because those islet cells are no longer producing insulin, these children get diabetes very, very early and a lot of times end up having to take insulin very early. Although technically you can get diabetes as an early adult or a young adult, I guess you'd call it. Anyway, type 1 is usually associated more with children and usually associated with damage to those islet cells of the pancreas. Type 2, this is more what we're going to talk about today. As a matter of fact, that's pretty much all we're going to talk about today. Because the kid stuff, I don't treat kids. And the third type, which is called gestational, that's primarily for pregnant women that get elevated blood sugars and diabetes during pregnancy. And since I don't deal with any of that either, we're primarily going to talk about type 2, which is what grandma had, and uncontrolled diabetes is what led to her mini stroke. One thing to clarify is that diabetes type 1 specifically has a very strong genetic component. Diabetes type 2 also can have a strong genetic component, but also has some other stuff involved, like environmental factors and food, weight, activity, things like that, that we'll, kind of talk about in a bit. And then, of course, there's gestational, which, that's pregnant women. So I don't have to ask a pregnant woman doctor thing. Yeah. Okay, so we kind of understand what diabetes is. Diabetes is usually a lack of insulin or a problem with insulin that allows your sugar to be higher than it's supposed to. And over time that can cause, not so great stuff. So what does it actually do to you that can cause all of these things? Like, how do you get a mini stroke? How do you get a stroke? For those that have watched my other videos on stroke and also things like coronary artery disease, and they see what blood sugars can kind of do in those circumstances, is very, very similar. So I'm not going to go over the whole thing again to bore people to death. But in a nutshell, you have a blood vessel, and high sugar can irritate the lining of your blood vessel. When the blood vessel lining gets irritated, your body does a bunch of stuff to basically try and repair that damage. And unfortunately, that leads to what we call a fibrous cap. And over time, as the sugar continues to irritate and your body continues to try and repair itself, it's kind of like scar tissue. Not exactly, but that's how I kind of think of it. Over time, these blockages can get worse. And unfortunately, red blood cells look like eyeballs. But these red blood cells can have trouble getting through this blockage, okay? Now, if they have trouble getting through the blockage in the noodle, you can have a stroke or a mini stroke. If it's in the heart, you can have chest pain or angina. You could end up having a heart attack. You could have blockages in your feet and in your legs. And unfortunately, you can develop what we call peripheral arterial disease, which is basically low blood flow to the legs, kind of like the heart and the brain, but like lower. For those who are keeping score, we can recap kind of what we were talking about with the sugar being, not good for things. Again, we talked about stroke and what it can do to the blood vessels in the brain. We talked about a heart attack, which is what they do to the blood vessels in the heart. We talked about peripheral arterial disease, which is, again, the arteries to the leg. Now, kidney failure, we haven't talked about yet, but your kidney obviously has a lot of blood flow. It kind of, filters all of it. So all of that blood sugar, if it's floating around in your system and it's higher over a period of time, can actually cause damage to your kidneys. And then people end up having kidney problems. Some people end up on dialysis. As a matter of fact, in the hospital, that's probably one of the more common reasons that we see people on dialysis is, unfortunately, uncontrolled diabetes. In addition to the kidney failure, you can also have things like neuropathy. Now, sadly, sugar can cause problems with the nerves, just like it causes problems with the blood vessels. It can cause irritation and it can actually cause damage to the nerves. Unfortunately, high blood sugar has also been shown to bind to a lot of the proteins that your nerves may require to transmit signals and stuff. So unfortunately, neuropathy is often a problem associated with long-standing diabetes. And neuropathy is one of those things where you can have more than one type. For example, you can have neuropathy where your nerves are super sensitive, like me. Unfortunately, it's very, very uncomfortable, and it's often associated with the feeling you don't want to have anything touch your skin, anything on it, like your jacket or your socks or whatever the case may be, because it's just so irritating. And then, unfortunately, the opposite side of that coin is kind of the neuropathy where you feel nothing and nothing. So a lot of times people come in and we see them in the hospital because they have horrible infections. We'll talk about that in a second, but the reason that they have a horrible infection is because they can't necessarily feel their feet. Sometimes they have a blister. Maybe your shoes are a little small, maybe they're a little big, and some irritation or some rub up against that part of your skin and you get a blister and then you can't feel it. Sometimes that blister pops and you have an open wound, and then unfortunately, it can become infected and you can't feel the infection. You can't feel the pain or the swelling or the irritation that you would normally feel because the nerves aren't working. So you don't don't feel much. Unfortunately, that's how these bad infections occur. People come into the emergency room and, they can be pretty severe by the time we get them. And that kind of leads to the other problem where high sugars can actually cause an increase in infections just by themselves, not because of the neuropathy, but because of the infection itself. Unfortunately, high sugars really prevent the white blood cells, which kind of helps get rid of bad stuff. Those white blood cells, they kind of don't work as well in very, very high sugar environments. And it prevents the white cells from not only functioning properly, but it also can prevent the white cells from finding or identifying things that are not good. So your white blood cells are kind of not seeing the bad stuff, and they're not able to get rid of the bad stuff as effectively. And on top of that, when we talk about peripheral arterial disease, well, how do your white blood cells get to places like your feet? Well, they get there by blood. So when you have peripheral arterial disease, kind of like strokes and heart attacks where you're not getting enough blood flow, that blood flow going down to your feet, if it's not enough, sometimes these infections occur because that's also how those white cells get down there. How does your body fight an infection? It sends stuff to the infection site to help kind of fight it. Well, unfortunately, it can't always get there. These white blood cells can't always get there if you have peripheral arterial disease or if they have trouble. On top of that, unfortunately, peripheral arterial disease can also cause problems with healing, like wound healing, because you have that blister and the blister needs good blood flow to heal. And if you're not getting good blood flow, unfortunately, things don't heal very well, which kind of increases our risk of infection even further. As you can kind of see how that's all, not great. So we talked a little bit about, what diabetes is as far as like a lack of insulin and, what it does to you, which is cause problems with your body using sugar, and then kind of what happens afterwards with the sugar kind of messing other stuff up. So then we start talking about, well, how do you find it? How do you know if you got sugar issues? Well, one way is what we see a lot, believe it or not, which is when people come to the emergency room for a completely different reason. They get sick, they got a headache, they got, something, and they end up coming to the emergency room and we end up doing some blood work and we're like, hey, your sugar's high. Sometimes it's like really high. And sometimes people know that their sugars have been kind of on the bounce. Sometimes people don't get checked regularly. And it's just like, I'm just here for my headache. And I didn't realize that my sugar was 400, but believe it or not, that's how we see it. We also see it the other way where people come in with some of the side effects of high sugar. Sometimes they're having chest pain because they're not getting enough blood flow. Sometimes they have a mini stroke like grandma and we weren't getting enough blood flow, and we find out that their sugars are really high at that point. Some people come in with wounds or infections, wounds that don't heal. And it's like, hey, we start checking for stuff, we see your sugar's really, really high. So how would you go about doing that? Like, what do we do in the emergency room? What do we do in the hospital? What do you do at the primary care office? Well, we go by three major things, okay? The first one is we look for a blood sugar. So it's simple, just draw a little bit of blood, see what your sugar is. Now, if your blood sugar is greater than 126 and you haven't eaten in like 8 to 12 hours, ideally 12 hours, but let's suppose you're fasting. We'll call this a fasting blood sugar. Yeah, fasting blood sugar greater than 126. Does that mean you have diabetes? No, that means your sugar is a little bit higher than it's supposed to be. Does that mean you absolutely are going to get diabetes? No, that just means we have to do some other stuff to check, and sometimes we just have to keep an eye on it. Let's suppose you're like me and you forget you have an appointment, and that's the one day you go to IHOP and pancakes and such. And for whatever reason, you eat that day a lot, and you come in and you're like, I didn't know I was getting blood work, and it's not going to be great because pancakes and such. So if your blood sugar is greater than 200 after you've eaten, especially if you've eaten like a bunch of carbohydrates and things that get turned into sugar. If your blood sugar is greater than 200, does that mean you have diabetes? No, that means you could have diabetes, and we kind of have to watch that, and we'll have to recheck and do some other stuff. So greater than 126, maybe. Greater than 200, maybe. So you think science would come up with something that's more definitive. And luckily we did. Not we, meaning me, because I had nothing to do with it. But people came up with something called a hemoglobin A1C, and this is the third test we do. Hemoglobin A1C. That is not a regular hemoglobin level, like hemoglobin like blood level. This is a hemoglobin A1C, which is very, very specific for sugar. And if that number is greater than 6.5, 6.5, do you have diabetes? And the answer is yes. That is actually a diagnosis of diabetes. So if your fasting blood sugar is greater than 126, what do we do to check? We'll do an A1C level or hemoglobin A1C to confirm it. If your blood sugar is greater than 200, maybe. What do? We confirm it with the hemoglobin A1C. That kind of begs the question of, what the crap is a hemoglobin A1C? Well, I'm glad you asked. Hemoglobin A1C is essentially a red blood cell that is coated with sugar. And over the period of about, 2 to 3 months or so, the amount of sugar on that red blood cell stuck to it can give us the average blood sugar over that period of time, which is like 2 to 3 months. So I kind of think of it this way. One of my favorite things is a glazed donut. Now, if you take that glazed donut and you have a box of sprinkles and you stick that glazed donut into your box of sprinkles, when you pull it out, some of those sprinkles are going to be stuck to that glazed donut. The more sprinkles that are in that box, the more sprinkles can get stuck to your donut. Now, that doesn't actually sound very bad to me, but in your body, when you're talking about sugar and a hemoglobin A1C, it's a little bit different in the sense that this red blood cell is floating through, your bloodstream. And as it floats along your bloodstream, it comes into these sugar molecules and they kind of bounce off each other. And some of these sugar molecules are going to get stuck, okay? Just like the donut. And what we do, not we, me, somebody else, smarter, actually takes your blood, they look at these hemoglobin A1C, these, red blood cells, and they figure out how much sugar has come in contact with that red blood cell over the course of its life, which is usually about, 2 to 3 months. That level will tell us whether or not you have diabetes, okay? That level, that hemoglobin A1C level, is not going to go up or down because of eating. For example, your hemoglobin A1C is not going to be better because you were fasting that day. And your hemoglobin A1C is not going to be great or worse because you had, pancakes that day, okay? The hemoglobin A1C will tell us the average sugar over the course of, 2 to 3 months. So if it's greater than 6.5, that means you have diabetes. That is a diagnosis of diabetes. So if a hemoglobin A1C of greater than 6.5 means you have diabetes, that must mean that a hemoglobin A1C of less than 6.5 means you don't. And yeah, not so much. A hemoglobin level, hemoglobin A1C that is, of less than 5.5 means you do not have diabetes. So if it's less than 5.5, even if your sugar is elevated a little bit here and there, you don't have diabetes. Could be pancakes. If your hemoglobin A1C is greater than 6.5, you do have diabetes, even if you didn't have pancakes. You see the problem there, right? So there's a no man's land between 5.5 and 6.5. What the crap is that? Well, this is something that we often call pre-diabetes, or more often we call insulin resistance, which then kind of begs the question, what the crap is insulin resistance? Well, I'm glad you asked. So what is insulin resistance? Insulin resistance is a nice way of saying that your body is not as sensitive to insulin as it's supposed to be. So your body could be, making enough insulin, but yet your body, the rest of your tissues, like your muscles and stuff like that, are not as sensitive to it, and consequently, your sugars stay higher than they're supposed to be. And then your body kind of responds by saying, hey, we need to produce more insulin. And then your pancreas is like, okay, anyway. So your pancreas starts making more insulin, and for a while that works. And over a period of time, as your pancreas makes more and more insulin, it eventually gets kind of tired and it doesn't make enough. And then your blood sugars start to creep up. So what is the most common cause of insulin resistance, or what are the things that really cause your body not to be so sensitive to insulin? Well, obesity and lack of activity are still the most common, okay? Particularly people that are overweight, their bodies have been shown to be less sensitive to the insulin that they're actually making. Even if their pancreas is making technically enough of it, their sugars are still high because their tissues, muscles, and all those other things are just not very sensitive to it. Lack of activity, unfortunately, is another cause. And when you combine those two things, they kind of like, feed off each other. So people that have some activity issues, not very, active, unfortunately can also start to gain weight because they're not very active, and then, stuff happens. So if you're wondering how insulin resistance occurs in, people that are overweight or people that have lack of, exercise and things like that, yeah, it's complicated, like really complicated. And there's a bunch of hormonal things and inflammatory things and all those issues that would be many videos on top of this. And I guarantee most people, including me, wouldn't stay awake through most of it. But it has been proven that people that are overweight and people that have lack of energy or lack of activity, I should say, do have resistance to insulin. The good news about insulin resistance, I'm not sure there's actually good news about insulin resistance, but I guess if you were going to say that there was something positive about insulin resistance, it's the fact that addressing both of those issues can really make a difference when it comes to getting you back to that level where you're not at diabetes anymore, where you're not technically diabetes, where your hemoglobin A1C is less than 6.5. A lot of times with enough diet, exercise, and weight loss, a lot of times people can get below that 5.5. Did it make the diabetes go away? Unfortunately, we always kind of carry that diagnosis of insulin resistance because that tells us as providers that we need to keep an eye on it, later on in life. But for all intents and purposes, you kind of got rid of it. So let's say you come to your primary care doc's office because of something else. In other words, you don't go to the emergency room because of a heart attack or a stroke and we find all these bad things. Let's suppose you're just not feeling well and you go to the primary care doc or provider to try and figure out why I don't feel good. Well, what are some of the things that high sugar can make you feel like? Even if you've never had a stroke, heart attack, peripheral arterial disease, neuropathy, all the things that we talked about before that are not so good, if you had some other issues, it may send you to get checked. What are those issues? Well, fatigue and weakness. Well, why is that? Well, we talked before about how insulin acts as a gate to allow sugar to get into stuff like your muscles. So if you don't have enough insulin and your sugar can't get to your muscles get weak and, weak. In addition to that, of course, then you can feel very tired and just fatigued all the time. And that could be a sign that your sugar is building up because you don't have enough insulin to allow the sugar to go into your muscles. Polyuria and polydipsia, big fancy terms, which basically mean I'm peeing all the time and I'm thirsty all the time. Polyuria means I'm peeing all the time. Polydipsia means I'm thirsty all the time. There'll be no quiz at the end of this, so you don't have to remember that. All you need to know is that peeing a lot and drinking a lot, they go together. Well, how does that work? Well, we talked about your kidneys and how high sugar can get to the kidneys because your kidneys filter stuff. That's kind of their job. Well, as they filter the sugar, okay, your kidneys, they're kidneys. They try and pee off the extra sugar because it's too high. So as you're peeing off extra sugar, all the water tends to follow it. So now you're peeing all the time. And because you're peeing all the time and you're losing all this water, then you're thirsty all the time because, you're dehydrated. So peeing all the time, wanting to drink all the time. And that's a thirst. It's like you're peeing a lot, not like a urinary tract infection. It doesn't burn, it doesn't hurt or anything like that, but you're peeing a lot. And then of course you have this thirst again. It's not like I'm just a little thirsty. No, it's like I can't quench this thirst. And it's because of the sugar. Sores and wounds. We talked a little bit about that also, where you can have low blood flow to your feet and your legs, and particularly with blisters and stuff like that. Sometimes a little blister, it just doesn't heal. It's not that it's infected, okay? It just won't heal. It won't get better. And a lot of times it won't get better because your sugars are too high. That doesn't mean you have blockages. You can. That doesn't mean you absolutely have to have a blockage. That doesn't mean it's absolutely going to get infected. But when you see a sore or a wound, particularly in the lower extremities, that's kind of where we see it the most, feet mostly. And you can get them other places too, but that tends to be the more common thing that we see in the hospital when they're not healing well, when we can't, get this cut or scrape or whatever it is to heal. A lot of times you'll end up there, primary care docs or urgent care, and you're like, why? Why is it not getting better? And then you check your sugar and it's, not great. In addition to that, you can get blurry vision. Some people with really high sugar, they're like, everything's blurry. And that blurry vision can kind of come and go depending on how high your sugar is. Well, how does that work? Unfortunately, very high sugar can cause fluid shifts into your, lens of your eye. And when your sugars are particularly high, you can start to get blurry vision. Now, the interesting thing about that is blurry vision can actually start to get better as your sugars start to come down. So it's not always blurry all the time. It can kind of, better and worse kind of thing. But high sugars can also cause blurry vision. People end up urgent care. They end up going to the eye doctor. They go to primary care and they're like, why is my, blurry? And they do some tests and it's just like, well, everything looks okay. But when they check a blood test, then, diabetes. And that also goes with things like, particularly women, they can develop yeast infections. Now, men can get yeast infections too, especially if we're kind of overweight and we get some, rolls and stuff, where skin and skin contact is kind of like a lot. You can get yeast infections of the skin. And of course, women can get yeast infections too when their sugars are, particularly high. But if you get yeast infections all the time and they keep coming back, even though we're treating them, that could be a sign your sugars are elevated. Now, I do want to talk a little bit about diabetes in the sense that, we know that your pancreas makes insulin and the insulin helps control the sugars. There are times where, diabetes is not always associated with genetics, is not always associated with damage to your islet cells or pancreas cells as a child. It's not always because you're overweight. It's not always because you don't exercise. Sometimes your pancreas can have problems spitting out insulin for other reasons too. And some of the things that we think of are things that would damage the pancreas because, that's where insulin is made. So alcohol, long-term alcohol, things that would irritate the pancreas or cause inflammation of the pancreas long-term, like pancreatitis. Yeah, too much up there, like pancreatitis. In addition to inflammation from things like alcohol, you can also have inflammation from like medications. Chemotherapy, for example, if you had a cancer, some chemotherapies can irritate the pancreas. That can lead to poor production of insulin. Radiation, if you had a mass or something on your pancreas or around there, and they radiate it, that can cause problems with your pancreas producing insulin as well. There's also other medications that can do it. Steroids, for example, can elevate your sugars and make you kind of insulin resistant. That can be a problem, especially long term. You just need to know that there's other things that can cause sugar issues that can also sometimes be out of your control. So we talked a little bit about what insulin is. We talked about what diabetes is. We talked about what diabetes can do to you. We talked about some of the symptoms that you may get if you're not making enough insulin. Then gets the question kind of, how do we fix it? Or, what do we do? Well, that's kind of difficult because each person is a little bit different and each person can kind of respond to treatment a little different. For example, most of the medicines that we give people make your pancreas either spit out more insulin or excrete more insulin, or they make you more sensitive to it. So a lot of the medicines we use do one of two things. Sometimes they do both. Now, for some people, if their sugars are particularly difficult, sometimes we just give them insulin because, that's kind of what their body, is lacking. And if it's difficult to control with some of the other medicines that we use that do those two things, sometimes we have to go to insulin. And what's important is that each person can have kind of a different regimen. Some people do well with one pill. Some people do well with 2 pills. Some people do 2 pills and shots. Each person can be a little bit different, and some people react better to certain, regimens. So it's difficult to say. What's important is that you find it, that you know that you have it, and then you treat it. Some people do really well with just diet and exercise, especially if you're in that window where your sugars aren't particularly bad. Your A1C is either insulin resistant, like 5.5 to 6.5, or if you're just over that. Technically, I have diabetes. My A1C, let's suppose it's 6.7 or 7, but now I'm doing a lot more activity and I'm losing weight and I'm doing better with my diet. A lot of times those things can make a huge difference. So we don't have to do some of the other stuff like, shots and pills and a combo of all the above. So that's my show for today. Hopefully we understood a little bit or learned a little bit about diabetes, kind of what it is, what it does, kind of, the bad things and, how to treat them or how to deal with them. Grandma, yeah, she's doing good. She's not so sweet. But that's because her sugars are better. And hopefully she'll get out of rehab pretty soon from that mini stroke. She'll be back in no time with, maybe some sugar-free pancakes if they make those. I don't know. But by the time she gets back, hopefully I'll be able to get you another video. So if you like kind of this medical content where we sit and talk about some of this stuff, go ahead, like, subscribe, and do all the things.